Good day. I am your Level 2 student nurse, Shekinah A. Redison from BSN 2A, and today I will be demonstrating the proper way of wearing and removing sterile gloves. In this assessment, it enables the nurse to handle sterile objects to prevent patient at risk of acquiring infection from the nurse's hand and also to eliminate microorganisms. So, we have our sterile gloves as our equipment in this assessment. And before anything else, we need to make sure to have our nails well trimmed to avoid the contribution of infection from longer nails, which are more likely can harbor dirt and bacteria, thus may contribute the spread of infection, and also trimming the nails to avoid puncturing the sterile gloves as well. Before we put on our gloves, washing of hands is very essential while making sure to follow all the steps of proper hand washing technique. To start, we need to find a clean, sterile surface and to start removing the outer package wrapper and then start opening the package of the sterile gloves while making sure to avoid touching the insides of the packaging to avoid contamination. Grasp the paper glove wrapper and place it on a clean, dry, flat surface. And while opening the inner wrapper touching the outer edges, we need to identify the right and left gloves. Use the thumbs and fingers of the non-dominant hand to grasp the folded inner surface portion of the glove for the dominant hand, touching only the inner portion of the glove. Be sure not to contaminate the glove as you lift the glove up, and then insert the dominant hand into the glove, palm side up, and pull the glove on. And then, pull the cuff down by touching only the inner surface of the glove. And then insert the four fingers of the dominant gloved hand into the sterile outer cuff of the outer glove, keeping the thumb pulled back out of the way. And then lift the glove up and insert the non-dominant hand into the glove without touching the skin of the arm with the gloved hand. And then this time, we may adjust the interlock fingers of our gloved hands. In removing sterile gloves, use your left hand in pinching the right glove near the top. And then, pull downward, allowing the glove to turn inside out as it comes off. Be sure to keep the right glove in left hand after removing it. This time, insert the two fingers of ungloved right hand under the edge of the left glove. Avoid touching the glove's outer surface, and then pull downward so that the glove turns inside out as it comes off. Discard the gloves in the trash container properly. And lastly, we need to do the proper hand washing technique once again to get rid of those possible microorganisms we acquired during our nursing procedures or assessments.